Hi guys, Dr. Minkoff here. Today I want to talk about what's called iatrogenic illness. Iatrogenic means doctor-caused, medical-caused illness. Now, in 2016, the British Medical Journal published a study which looked at what were the greatest causes of death in the United States. So number 1 is heart disease, number 2 is cancer, and number 3 is iatrogenic illness. This is doctor-caused illness. Now, this isn't a small number. This is a third leading cause of death in the United States. 250,000 people a year die because of medical errors. That's 250,000. Now, put this in perspective. A 747 jet holding 250 people, that would be 1,000 of those a year crashing. Okay? Every 3 days, a 747 jet goes down all year long. How many of you would fly? I wouldn't fly. That's how many people are being killed through medical errors today in the United States. Now, I want to put this in a perspective. Every year, the Poison Control Centers of the United States tally how many people called the Poison Control Centers to report an overdose, a problem with something, medication something. And they track, as a part of that collaboration, vitamins, minerals, amino acids, essential fats, herbals, homeopathics. And guess how many people died or die per year from those causes? None. Okay? Now this is really important, because if you have a medical problem and you need help with it, the first place where you should go is someone who's knowledgeable in nutrition or the natural handling of the body and disease, because you aren't going to die from their treatment, because they're using things that don't kill people. If you're really sick, or you're in the middle of a heart attack, or you just broke your leg, of course, go to a doctor, go to a hospital, get the best treatment. I'm not talking about that. But if you have high blood pressure, or you have diabetes, or you've got arthritis, or you've got an autoimmune disease, you are much safer and much better off going to a natural practitioner, a naturopath, a nutritionist, a chiropractor, a nutritionally trained medical doctor, a homeopath, because their means of treating you aren't going to kill you. And chances are they can help you, because most of this stuff is susceptible to cure with natural means. And you won't be the statistic where you're in big trouble because you got the wrong medication, or you reacted to the medication, or you got the wrong blood transfusion, or there was a mistake made on some other level. This isn't a little thing. This is a huge thing. This is a catastrophe. And so as part of my outreach to people, it's like, look, if you have to go in a hospital, okay, you got to go in. Something's really wrong. You should do that. But if you're going to stay in overnight, bring someone with you. Make sure that when the person walks in that room, that they wash their hands before they touch you, that they wipe off their stethoscope before they put it on your chest. Because infection is one of the things that is part of the statistic, and it's huge. People get hospital-acquired infections, and they can get really sick from them. Okay? So there's some things that you can do, which is if you have to get emergency medication or situation, is that you get someone with you, because you're probably not feeling that well, and you can have someone who's got their wits about them to be with you to sort of help you and to protect you. Now, sometimes doctors use scare tactics to get people to do something. Most of the cancer patients that I see have seen an oncologist who says, if we don't do this, you're going to die. And that may or may not be true. And I always, when I see a new cancer patient, I make sure that they've seen an oncologist at the same time so that they can get another opinion. But a lot of times the information that they're being told, which does scare them, or you've got blocked coronary arteries, and if you don't get a bypass right away, or you don't get a stent right away, you're going to die. These things are just not true. If they keep living their life the way they are, they probably aren't going to resolve their illness. But if they go to a physician or a healthcare practitioner who can work with them on diet and supplementation and lifestyle changes, many of these cases can be resolved, and they don't need invasive procedures, which can be very dangerous and harm them. And so I think I just want people to know this because this is really important. Now, I have a really good example because I saw a patient yesterday in the office. And she came in because she has what's called Graves' disease. Her thyroid is massively overproducing thyroid hormone. And she was really in trouble. She went to the emergency room because her heart was beating 180 times a minute, and she'd lost like 18 pounds in the 3 weeks before, and she was very weak, and she didn't know what was going on. And they did a blood test on her, and they found out that her thyroid levels were 2.5 times maximally acceptable. And they put her on an appropriate medication, which is called a beta blocker, because they had to calm this body down because the thyroid hormone was so overactive that it could have killed her. So they put her on a beta blocker, which was the appropriate treatment. And it settled her pulse down, it settled her blood pressure down, and it settled her down. And then they were going to refer her to a physician. She needs to get an ultrasound of her thyroid. It could be a tumor. It could just be thyroid inflammation. And the suggestion of that practitioner was that she get radioactive iodine injected into her body or her thyroid taken out. Now that is an extreme position by that doctor for her treatment. Now unfortunately that doctor has never had success with doing anything else. But someone like us, where we see these cases, we almost always can resolve these cases doing the methods that we do. And their hyperthyroidism goes away. Now, she had 2 infected root canal teeth in her lower jaw, which were leaking toxins into her thyroid. And I know that from the interventions that we're going to do to clean up that infection and improve her nutrition, that her hyperthyroidism is going to go away. And she won't have had to get radioactive iodine or have her thyroid removed. So there's lots of different areas like this where things can be done to really, in a more natural way, without risk, is to help people. And so when you go to the doctor, I think it's good to keep this in mind. I don't think doctors are malintended. I am one. And I practiced regular medicine for a long time. And most of the people that are doing it are really good people, and they really want to help people. But there is a knowledge gap, and if the doctor doesn't have the knowledge, they're not going to be able to do something else. And so people get trained in a very certain pathway, and that's what they know, and they can be very good at it. But there are more than one way to skin a cat. And sometimes you can skin the cat without taking off skin, and the cat can get better, okay? Which is what we want, okay? So if I can't handle it, I'm going to send to the guy to take out the thyroid, okay? I will do it. But at least we did something else which usually works. We find about 85% of the time what we do works. It actually works. And they didn't get the thing cut out, or they didn't get the invasive procedure, and they're doing fine. And so I just think this is important for people to know and remember and take into consideration, because that's a lot of 747s going down. And that's you and me and our family and our kids and our grandparents and our parents. And they don't have to have died from that, because these are medical errors. And the other thing about this is the number is way more. Because in the coding on a death certificate, there is no code for medical errors. Okay? No code. So this isn't even kept track of by the authorities who keep track of medical statistics. This was a study done by Johns Hopkins, published in the British Medical Journal, where they got this data. Okay? So it's probably way, way more than that, and it just, nobody ever knows. So doctors provide very good functions. And when they're in their sphere of doing good, they're good, okay? Sometimes you need a C-section. You need your leg set. You're having an emergency heart attack and you need a procedure done. Great. Do it. But in the other stuff, where it's, a pain here or there, or an ache, or a blood test that's abnormal, or you've got cancer, look around, because there are other people who know things who may be able to help you, and their means of helping don't harm. This all comes back, Hippocratic Oath. Every doctor attests to it when they get their medical degree. Do no harm. First of all, do no harm. Okay? So if we can help without harm, we're way ahead. I hope this helps.